welcome. You're watching NDTV 24/7. This is a special broadcast. I'm Sonal Mehrotra Kapoor. Now, the COVID-19 pandemic has had positive and negative impacts on different aspects of our day-to-day life, our lifestyle, our behaviors as well. Negative lifestyle behaviors associated with increased risk of adverse outcomes from COVID-19 while dealing with COVID. And we often overlook the fact that people's lifestyles were severely disrupted. Many people have become physically inactive, developed irregular eating patterns, which led to unhealthier lifestyles and aggravated several diseases as well. COVID-19 pandemic has also caused significant changes in our home, in our work, in our life, stress levels as well. And that's why a multi-sectoral approach, talking about healthier diets, increasing physical activity, is the only way to actually slow down what is being now called a diabetic epidemic, and also one that will lead to several heart diseases as well. This is Beat Diabetes Myths and Facts, and on this program we talk to experts and bring you some usable, fundamental answers on how to move forward in your health journey. Joining us today on the program, we have Dr. Surendra Kumar. He's MD, endocrinologist from Sir Gangaram Hospital, New Delhi. Thank you so much for your time, Dr. Kumar. We also have with us Dr. Arvind Minz. He's MD, Senior Consultant, Internal Medicine at the Sarvodaya Hospital Research Center in Faridabad. Also with us today is Dr. Mohanty. He is MD, DM Cardio, Senior Consultant there at the Department of Cardiac Sciences, SUM, Ultimate Medical Care, Bhubaneswar. So we have doctors spread across the country, and they will be talking to us everything you need to know about diabetes and everything you need to know about your heart's health as well. Let me begin and take the first question to Professor and Dr. Surendra Kumar over there. Dr. Kumar, as we all know that COVID-19 affects diabetes patients badly. It's not because the virus is attracted to them, it's just that the body takes it. To stabilize a diabetic takes much longer, and that's why the complications actually come in. There are warning signs as well that have been talked about, but somebody who has recovered from COVID and has diabetes, what would be your prescription to them for their post-recovery care as well? We've often heard about long COVID. So many people we still know still suffering from it. What do you think are the quick tips that they can adopt to get on with life as normal as possible now?
The first thing to be understood by public is that the prevalence of COVID, or for that matter, corona infection, amongst diabetics who have been treated well, who have been under good control, the prevalence is same as in non-diabetics. So that means poor control of diabetes plays a very important role in increasing prevalence and also in causing complications. And complications are much more in people who are diabetics because the long duration of diabetes, the pre-existing poor control, what is called the metabolic legacy, which is on the negative side. So these things play a very important role. Now coming to your specific question, that if a person has recovered from COVID and unable to feel well, feeling weak, tired all the time, not able to resume his normal activity, so this means something is there. And one of the commonest thing is that the blood glucose could be on the higher side. So even if he is a non-diabetic, he should look for the test and get ensured that the blood sugar is not high. If it's high, treating this will control the complication in a major way. His quality of life will improve significantly. Whereas on the other side, if it is a diabetic, then of course, because of the treatment, the glucose goes very high, and those drugs are essential. That's called steroids. So with the use of steroids, the blood glucose goes very high, and then it adds to the complication.
Let me take the next question to Dr. Arvind then. Dr. Arvind, many people post-recovering from COVID-19 are developing high blood pressure. What could be the reasons behind this, and how does one manage the same? Is it only because of stress levels, as is being often talked about, or there is a linkage there?
Now, let's not forget COVID has been a multidisciplinary infection and inflammation. Post-COVID, elevated blood pressures are usually because of multiple technicalities happening in body due to the present inflammation. The work of breathing goes up because of the lung fibrosis and other changes. The heart rate goes up to compensate for that, resulting in a higher blood pressures. Now, that is the organic part of the mechanism of high blood pressure. The non-organic part, as in the super added things which can add on to higher blood pressures, high heart rate, would definitely be the trauma and the stresses they have been through. Imagine the plight of a person gasping for breath every breath that he takes for weeks altogether. That's something like a post-traumatic stress disorder, the PTSD. So the anxieties definitely have a marked overlay. They are absolutely insecure, anxious, conscious of every breath they take. Add on to that the changes that happen in the lung and subsequently into the heart, leading to higher blood pressure values. Now, the first of all that one needs to do is definitely consult the doctors, take care of the blood pressure medications, get the blood pressures and as well as the heart rate under control. Some people might even require anxiolytics to take care of their anxiety parts or subsequent depressions associated with it.
All right, let me move on to Dr. Mohanty next. A person who has undergone stent implantation, Dr. Mohanty, and has been cured of COVID infection, what are the chances he or she can get a heart attack again? How vulnerable they are basically?
Now, we all know that following COVID-19 infection, for the first 7 days, the risk of a heart attack increases by at least 2 times. This is there with all patients who have a COVID-19 infection. Now, a patient who has already undergone a stent implantation implies that he already has a cardiovascular disease. In that event, for him to develop a subsequent heart attack following a COVID-19 infection is much more than 2 times. So the suggestion will be that such patients who have undergone a stent implantation and develop a COVID-19 infection need to continue with their cardiac medications, need to be in touch with their cardiologist, and any untoward symptoms like chest pain, difficulty in breathing, that might suggest involvement of the heart leading to heart attack. For such symptoms, they need to quickly consult their cardiologist and take appropriate therapy.
Let me take the next question to Dr. Surender Kumar then. Dr. Surender, people talk about uncontrolled blood sugar. What exactly is meant by uncontrolled blood sugar? Just taking a cue from your last answer there as well. When should a person with diabetes start to worry about his or her uncontrolled levels as well?
Well, uncontrolled glucose or blood sugar is of two types. One is acute, something like a person whose good blood sugar shoots up to 500, 600. The patient can go into coma also. So that is acute. Other acute part is patient is losing weight very rapidly. There is increased thirst, and another smaller component of this is recurrent infections, poor healing of the you can say the wounds, etc. So these are acute situations. Others are which are more harmful or the chronic poor control of the glucose. And this is the group where patient doesn't know the glucose is on the higher side, but then the complication like heart problems, foot problem, or kidney problem, eye problem, they get in. So these are two types. So now coming to the main question that what time one should get worried. Truly speaking, one should get worried even before the diabetes. If there is one risk factor like the family history of diabetes, one should get worried and try making all the effort to prevent diabetes. So that's the step number one. Step number two is that if he is not diabetic, annual investigation should be done so that he comes to know that when he is in the pre-diabetic stage, and then efforts can be started to prevent the onward march of the event. And the next is that if during annual investigation or otherwise it's found that he has crossed that limit of fasting 126 and postprandial of more than 150, 60, 70, then he is called diabetic.
Dr. Arvind, people are using glucometers to check glucose levels at home, which is a good thing, of course. However, most of them hardly check their HbA1c. And how important is it to actually get this test done regularly? How dependable are these tests that are basically self-tests at home?
Checking a regular glucose values through a glucometer definitely is a good idea. But let's not forget, diabetes is a very dynamic process. It changes, it has too many compounding factors. One has to be taken care of. One has to take care of those compounding factors. It depends right from the stress levels to the activities one does through the day and to the meal and the calories one consumes through the day. Now, usually people check fasting or PP blood pressures, which are more or less under a supervised scenario. One wakes up in the morning, checks the blood pressures, and so, okay, I've got a 2 PP blood sugar. They are cautious about what they eat and how they eat. But during the rest of the day, we actually forget about it. So more often than not, even if the fasting, the PP value looks beautiful, but if you look at the HbA1c, it's kind of sky high. And then we say, oh, where do we go wrong? Because a good fasting and a PP value gives us a sense of, complacency. So yes, HbA1c is a wonderful idea. Actually, everyone should get the HbA1c done every quarterly. It gives you a fair idea where we have been going wrong. And moreover, scientifically, HbA1c has been shown to correlate with the cardiovascular complications, to the retinopathies. So yes, it helps us navigate better. It's kind of a check in place, so that even if the fasting, the PP looks good, we're not complacent. I would strongly recommend, and it's actually recommended by the bodies world over, to keep a regular HbA1c done on a quarterly basis.
All right, let's take the next question to Dr. Mohanty then. Now, Dr. Mohanty, people often take high blood pressure lightly, especially now during this pandemic. There is a surge of hypertension in patients as well. What are the possible complications that could come out of it? And if you could tell us some good ways to actually stay out of it.
Now, hypertension is in fact known as the silent killer. Why is it so? It is because most of the people who suffer from hypertension do not suffer from any symptoms, or they do not suffer from any problems per se in the early stages of hypertension. So they often tend to ignore the treatment of high blood pressure. And when they become symptomatic, it is the result of some kind of permanent damage to the body. And by that time, it is often too late. Now, hypertension is a disease that can involve multiple organs of the body. Starting from the brain, you can develop a stroke. There can be clogging of your arteries in the brain, or there can be bleeding inside your brain. And then you can develop paralysis of one half of the body. Then your eyes can get damaged and you can lose your eyesight. And then coming down, your heart definitely gets involved by high blood pressure. Two important diseases that are the result of hypertension are coronary artery disease, that is where the arteries of the heart get clogged with cholesterol, leading to either heart attacks or chronic stable angina. And secondly, another important cardiac disease that can develop from under treatment of hypertension is heart failure, where your heart muscles get weakened and or they fail to relax properly, and that causes accumulation of fluid in the lungs, and so that the patient develops difficulty in breathing and swelling of your feet and other problems. And then in addition, the kidneys can get damaged as a result of hypertension, and the arteries of the limb that carry blood to the arms and legs can get clogged by cholesterol deposits if hypertension is not appropriately treated.
All right, with all that information, let's slip into a quick break. We continue this conversation on the other side. Stay tuned. Welcome back. You're watching Beat Diabetes Facts and Myths, and we are in conversation with our experts. Let me take the next question to Dr. Surendra Kumar. Dr. Kumar, when you have diabetes, you need to worry about other health conditions as well, right? There are tests people with diabetes should do regularly along with the blood glucose test as well. Could you tell us some of them that one should get done, and how frequently should these tests be done?
Well, a diabetic is prone for complications, and those complications are two types. One are called big vessel complications, other called small vessel complications. And despite best control and everything best, certain complications are based upon the genes. So one is definitely prone for some complication, but whatever can be done is to control the blood pressure well, to control the lipids well, and in addition to that, most difficult is to control the glucose in a proper way. Glucose control is not only fasting and PP, but variability in the glucose is probably found to be more harmful in causing complications. Investigations were not called daily or weekly investigation, like to maintain the glucose control. So one can check pre-meal values, one can check post-meal values, keep a record of them. It's not only the glucose value which is to be checked, but maintaining record and seeing the record. The trend that sometimes gives us information whether the glucose is going down or is going up. So that's important. So other is routine urine investigation, a simple routine investigation of urine examination, because the neuro drugs which have got great potential to tackle the disease very properly, they can cause infection. So these are routine investigation which patients should get done. Others are annual investigation to see whether a complication has occurred or not. They are kidney test. One is serum creatinine and blood urea. Other is microalbumin. These two are equally important. And then comes your lipid profile, your HbA1c has been mentioned. Then of course annual investigation like ECG, maybe once in 5 years ultrasound abdomen can be done, and then TMT depending upon the duration of diabetes, etc. Beyond 10 years, everyone should get a TMT done. So those are annual or periodical investigation. So routine investigation, regular monitoring of the glucose. Regularity could be daily, could be once a week, could be once a month, but all the pre and post meal values.
Let me go to Dr. Arvind next. Dr. Arvind, if you are living with type 1 or type 2 diabetes, continuous glucose monitoring, like we talked about, can help you make more informed treatment decisions as well. That can lead to better glycemic control as well. At which stage of diabetes is it considered, of real use? Is it necessary for people with diabetes? Like I said, just to understand which way they are going, what is the best way to sort of monitor your levels?
CGM, or the continuous sugar monitoring devices, are wireless devices attached to the body, which continues to measure blood pressures 24/7. It's a wonderful thing which has happened for people with a labile, or as we say, brittle diabetes, people with type 1 diabetes, people who have a poor control on sugars and don't know where they're going wrong. So in principle, one doesn't have to prick the finger every time one has to measure the blood sugars. The CGM does it for us. All you need is a sensor and you check out the sugar values. But the problem here is the cost, which can be exorbitant and cannot be used on a 24-hour basis, 365 days a year. So CGM definitely helps people who are unable to control the diabetes. It's wonderful for kids of type 1 diabetes. It's wonderful for type 2 diabetes, where the controls are poor and the blood sugars keeps jumping around, hitting highs and lows, and is erratic at abnormal times of the day, irrespective of the activities. So it does help one to plan the diet. It does help one to chalk out the activities through the day so that it does not affect the blood sugars and far too gravely. It does helps the doctors to modify the medications, the doses of the oral anti-hypoglycemics or the injectable insulins. So it kind of does have a lot of ifs and buts, gives us a small straighter pathway to walk on with the two margins on the side.
I see. Good tips over there coming in. Let me take the last question now to Dr. Mohanty there. Dr. Mohanty, due to free access to social media and search engines, people think they can lower a very high LDL cholesterol level through diet alone. But could you tell us if that is a myth or a fact? What is the role of statins as well in lowering LDL levels? Is it necessary? I know there's a huge debate on whether or not to statin.
Yeah, most of us have come across messages being circulated on social media regarding the uselessness of statins regarding lowering of LDL cholesterol. But it has to be made very clear to the public at large that statins have been definitely proven beyond doubt by multiple scientific trials to have beneficial effect in lowering LDL cholesterol levels. Now, LDL cholesterol lowering leads to a decrease in the risk of heart attacks and ischemic strokes involving the brain. In addition, statins act by many other ways in addition to the lowering of LDL cholesterol level in reducing the risk of heart attacks. So statins have multiple effects. They are very useful group of drugs, and we need to accept that they play an important role in treatment of cardiovascular diseases.
All right, that's all we could pack in today's edition. To all our guests, Dr. Surender Kumar, Dr. Arvind Minz and Dr. Mohanty, thank you so much for your time. We'll catch you again soon. Bye-bye.